Hello, everyone. My name is Annamma George. I'm the diabetes educator for Valley Hospital, Ridgewood, New Jersey. I'm going to be talking about what is prediabetes. So what is diabetes and prediabetes means? And what are the risk factors for diabetes? How can you delay or prevent type 2 diabetes? Those will be my talk. What is diabetes? Blood glucose level higher than normal. Not enough insulin to allow glucose to enter cells to be used for energy. There are two types of diabetes, type 1 diabetes, type 2 diabetes, gestational diabetes. There is more category, but the main category is type 1 diabetes, type 2 diabetes, and gestational diabetes. Let's go over one by one. What is the type 1 diabetes? Usually it's diagnosed in children and young adults, but again, it can be diagnosed in elderly as well. It is an autoimmune condition that comes in out of nowhere. People can become type 1 diabetes, especially this pandemic. I noticed that a lot of people becoming insulin deficient after the COVID-19. So there is a lot of viruses can attack pancreatic cells and produce an autoimmune response into your pancreas and shut down the production of insulin in their pancreas and become type 1 diabetes. So you cannot say that it comes in only children and young adults. It can be any age group. And type 2 diabetes is the most common form. It's 95% of the diabetes is type 2 diabetes. And it's very familial. So the family inherit the gene passed down to the children, most often diagnosed in adult age. So it was called as adult onset diabetes in the past. And then that terminology is not existing anymore because more and more teenagers or youngsters, young children are diagnosed with type 2 diabetes, which is an adult onset. So vice versa with the type 1 diabetes was the juvenile diabetes, that terminology is not existing. Now it's changed to type 1 diabetes, and type 2 diabetes was an adult onset diabetes, which is called as type 2 diabetes. Let me clarify this. There is type 1 and type 2. And again, in endocrinology practices and everything, a lot of people are using a category type 1.5, even though it's not American Diabetes Association or any clinical endocrinology did not classify that, but we are seeing a lot of patients, they are not purely type 1, they're not purely type 2, but they are coming in between categories, so we are referring them at 1.5, even though it's not put it down in book or anywhere, but we are referring them at 1.5. So 1.5 category people have no production of insulin in their body, but they are not autoimmune in nature. That means they don't have autoantibodies like in a type 1 diabetes. So they became insulin deficient. That's what I'm seeing more like after the pandemic and virus attack to the people. I'm seeing more and more people became insulin deficient. So they are coming under the type 1.5 category. So moving forward after the pandemic, probably we will be categorizing 1.5, who knows? Anyway, the third category of diabetes is gestational diabetes. That appear during pregnancy. Are high risk for type 2 diabetes in their later life. It's 60 to 70% of chance of developing type 2 diabetes in their later life if they are not careful with their weight management. So, so I always tell my gestational diabetic and say that they their diabetes is going to be gone after the baby born, but again, they are very high risk. 60 to 70% of developing type 2 diabetes in their later life. All right, let's go back to our primary topic of what is prediabetes. Prediabetes comes before type 2 diabetes. Blood glucose higher than normal, but not yet diabetes. You can have prediabetes and not knowing it. So many people are walking around with prediabetes and not knowing it because it's not symptomatic. So, usually it takes 10 to 12 years of prediabetes before they become full-blown diabetic. So at that time, during the prediabetes time, there is a lot of nerve damage happening. There is kidney damage happening. And there is a damage in the retina happening. It's all happening during the 10 to 12 years. If someone say that they haven't seen a doctor for 8 years and they come in with a diagnosis of diabetes type 2, then I would say, oh, I was not diabetic at all of a sudden I am diabetic. So they miss their opportunity for improvement for pre-diabetes time. So 8 years of not seeing a doctor means they haven't seen a doctor and not checking their labs. So then they don't see that they are pre-diabetic. So that's why we are concentrating on pre-diabetic people so that they can prevent becoming diabetic. How are diabetes and pre-diabetes diagnosed? Diabetes fasting blood sugar should be over 126 milligram per deciliter or higher. Pre-diabetes is fasting blood sugar between 100 to 125. And that's the way that they diagnose it. And also, there is a way of testing hemoglobin A1C. That's a 3-month average blood sugar test that we do as a lab test from your, it's a blood test. Hemoglobin A1C is a 3-month average. What does that mean? It's hemoglobin is the red part of the blood. Every time a hemoglobin sees a molecule of a sugar, it attaches or pairs it up and then walk around like a twin walking around in the blood. So if you're measuring how many pairs of glucose and hemoglobin are building up in your system, and that's what we are measuring, it comes in like a percentage. The normal A1C or hemoglobin A1C is under 5.7%. Between 5.7 to 6.4, they call it pre-diabetic range. When you reach a 6.5 and above, they call it diabetic range. So that's the way they diagnose it. So if you want to check your blood level and if you're not having a regular physical, especially, when you're age 45 and older and overweight, you should check your blood glucose for prediabetes and A1C testing started. I would say earlier is better because, even if you're like young, adults, about 20 and they're obese, I would start testing them for prediabetes at that age so that you can start treating them, lifestyle modification and everything to prevent becoming diabetic when they are in their 40s. So according to the American Diabetes Association, their criteria is to test their people age 45 and older and overweight. But I personally prefer myself for better management as long as they are adult age, like after teenage, like in 20 and above. Make sure that you test the A1C and see how things are. And if they are obese and if they have a family history of it, start testing their A1C every year. And moving, weight reduction and lifestyle modification from that point on. And the other criteria they said in American Diabetes Association is age 45 and older and not overweight. Ask your doctor if you need to be tested. But again, it's person to person, and we do according to a different scenario. under age 45 but overweight and at an increased risk for diabetes, yeah, you test. Risk factors for prediabetes. A parent, brother, or sister has diabetes. You are African American, Hispanic, Latino population, or Native American or Asian American or Pacific Islander. The highest incidence of diabetes is in Native American, and then comes Asian American, Pacific Islanders, and Hispanic population, African American. That's the way that it's go. All the cultural food that they eat, or I don't know if genetic predisposition, some reason, this population are higher risk for diabetes. You had a baby weighing more than 9 pounds or had gestational diabetes. As I said earlier, people who are gestational diabetes have 60 to 70% of teens of developing type 2 diabetes in their later life. The other risk factor is you have a high blood pressure, over 140 over 90. If you have a blood pressure, it goes along with diabetes also. And if you have a low HDL, that means a good cholesterol level below 40. And if you have a high triglyceride over 150, these are all risk factors. Since I'm talking about the HDL, I just wanted to explain about this cholesterol. The cholesterol particles, the total cholesterol is divided into 3 different categories: HDL, LDL, and triglyceride. HDL, or high density lipids, are happy cholesterol or good cholesterol. It needed to be higher in order for the LDL, which is the lazy cholesterol, to be removed out of your system. So if you have HDL higher, the LDL is going to be removed out of your system through liver and everything. So, and the other thing is high triglyceride. When I see somebody's labs, if I see that it's triglyceride is high, I would say those people are eating too much of carbohydrate. From the blood work, without even asking the patient, I would know this person is eating too much carbohydrate or drinking alcoholic beverages with fruit juices in it, and or wine, or regular fruit juices or sodas and this and that. So those are the key questions that you could ask. So those are the risk factors for developing diabetes. If you have prediabetes, what does it mean? You might get type 2 diabetes soon or sometime in the future. So I would say, prediabetes is the best time. If you diagnose it, that's the best time to get a hold of this diabetes, and so that you can prevent diabetes happening by lifestyle modification, eating right, exercising. All those things are helpful tools. During the prediabetes time, you are more likely to get heart disease or have a stroke. Let me explain to you why. Prediabetes is the time your pancreas is working harder and producing extra insulin because of insulin resistance. So insulin resistance, so your body is producing extra insulin, which is floating around. Insulin is a growth hormone. It's grow arterial wall thicker and the lumen gets smaller. So if you have high blood pressure and high cholesterol goes along, and then you will have a clot buildup in your artery that can travel to your brain, which is brain attack or stroke, that can travel to your heart, which is heart attack. So this is so dangerous time. So the prediabetes is the worst time to have heart attack and stroke. Being a diabetes educator at this hospital, so I have seen many cases that comes in with a heart attack and stroke, and at the same time they are diagnosed with diabetes. So that means they've been pre-diabetic for past 10 years and they didn't even know. So that's why it's very crucial to treat the pre-diabetes early. Diabetes is serious. You will be healthier if you delay or prevent diabetes. Diabetes is very common, but you can reduce your risk by losing weight. Okay, delay or prevent type 2 diabetes with regular physical activity such as walking almost every day. Weight loss is a key thing. I would not suggest to you to join gym, especially at this pandemic time and everything. So, but you can do a lot of activity at home. I find it that is, your household cleaning is a moderate physical activity, vacuuming the house, cleaning the bathroom, and working on the garden. All those things are very good activity that you can enjoy at the same time. You can take credit for having physical activity. So weight loss is another thing. How much weight loss and how much activity you needed. So diabetes prevention program studies show that 30 minutes a day of moderate physical activity, along with a 5 to 10% weight loss, produced a 58% reduction in diabetes. Look, see, it's only needed at 30 minutes of brisk walk or moderate physical activity like cleaning the house, vacuuming or bathroom cleaning or gardening. All those things are counted. And 5 to 10% weight loss. If somebody is 200 pounds, 10% means, like it's 10% is nothing for them, but even that is going to have a big impact on their A1C. So that means, according to diabetes prevention program, they said that 30 minutes a day walking or physical activity of any choice with a 5 to 10% weight loss produce 58% reduction in diabetes. That's great. So if you weigh 150 pounds, so losing 5 to 10% is 8 to 15 pounds for them. And like that, 200 pounds, 10 to 20 pounds weight loss. So it's a reduction of 5 to 10% from your weight. How much do you weigh? How much is 5 to 10%? So the calculation, you can do it. 5 to 10% weight reduction is necessary for benefit. So how do you attain weight loss? The strategies for losing weight. I would say number one is cut back on calories and fat. So calories means, I would say first you have to avoid concentrated sugars like cookies, candies, cakes, puddings, ice cream, sugar, all the sugary items, and also juices, sodas, all those things, and fat. If you cut back on that, that's a good way of losing weight. Second, be active most days of the week. Third, eat breakfast daily. Keep your metabolism going. So fourth one is keep records of what you eat and drink, daily physical activity, and your weight. You don't have to show it to anybody. You can keep a record for yourself and what you put in your mouth. You will be amazed at the end of the day. You look back and say, oh, gee, I did this. So it's a very good way of looking back and see what you ate for that day and cut back on calories like that. That's a great way of doing it. Strategies for losing weight continued is the next one is implementing a weight loss program on your own or through an organized weight loss program like Weight Watchers. So you can join a program and do it, because if you're not self-disciplined, you can do it with the organized weight loss program. Combination of meal planning and physical activity is most successful. Records helps keep you on target. Write it down, everything you eat and drink, including serving sizes. It's a very important point that you should start label reading. When you're buying stuff, you can read through the label. What is the carbohydrate amount of that meal? What is the sugar content of the meal? What is the protein or fat or all these things? So you have to have a certain amount of that and cutting back on the amount that you eat. How much is the fiber in that item? So it's a serving size is another thing that you have to look. So for example, we all eat the cereal in the morning and we don't know exactly how much is the serving size. So it's a serving size listed. You have to be very careful and read it before you eat. And sometimes we eating 2 serving sizes thinking that it's only 1 serving size. So you have to make sure that you include serving sizes when you're writing it down. your physical activity, what kind and how long you're doing it, your weekly weight, you can record it. That's another way of doing it. You can use a small notebook or ADA's My Game Plan, food and activity tracker, or anything that works for you. You can even use a simple marble book. You can keep a record of that. So keeping a record like a My Game Plan food and activity tracker, that you can get it from American Diabetes Association. So you can get that and print it out, or you can download it. You can delay or prevent type 2 diabetes with regular physical activities such as walking almost every day and weight loss. Learn all you can to help lose weight, be more active, eat healthy. Other preventing diabetes programs, cutting calories and fat and being active. A new powerful risk assessment tool you can find in American Diabetes Association. You can enter your personal health information. It's called Diabetes PhD. That is the personal health decisions. You can get into the American Diabetes Association webpage and get that tool. So enter your personal health information, receive a personalized results overview showing your current risk for diabetes, heart attack, and other health problems. Change items in your profile, such as walking more or losing weight, to see how making these changes would impact your future. So this is a very good tool. I would highly recommend to go into the American Diabetes Association webpage and look for Diabetes PhD. That's a personal health decisions. So you can download and enter your personal health information and change it every week and see how you are doing. That's a very good way of doing it. So when you print it out, it gives you like a graph and see where are the areas that you want improvement and everything. So diabetes.org/PhD, that's the way you're going to get into this webpage. For more information that you can go into American Diabetes Association about preventing diabetes, you can call 1-800-DIABETES or visit diabetes.org. Contact your local ADA, American Diabetes Association, at 1-888-DIABETES to learn about activities and volunteer opportunities in your community. That's it. Thank you so much.